Women take care of everyone: kids, parents, family. But what about their health? To talk about the health of women in India, I have with me Dr. Sangita Reddy, Joint Managing Director at Apollo Hospitals. Dr. Reddy, thank you so much for joining us. Doctor, you are a global healthcare leader. You're a woman, and I'm sure that you must be seeing a lot of data coming from Apollo ecosystem. So I just want to ask you, what is the status of women health in India right now?
So thank you, Himani. I'm so glad we're having this conversation on the eve of Women's Day. And I think it's very significant for us to really not just think and dream, but really push towards a positive, proactive, health-aware population, both men and women. And women hold the role of taking care of their own health, but also the health of the family. In terms of the trends which we are seeing, so traditionally, women, of course, were not considered, uh, very proactive about their health. So we saw them in a late stage coming with cardiac problems, cancer. 1 in 7 women will get breast cancer. We definitely saw women coming with hypertension, and that's a very significant number, actually. 12% of women are suffering from hypertension, which I think is a very, very significant number. This is because of stress and various factors. Of course, obesity, which leads to other cardiac problems and other various non-communicable disease get heightened, especially diabetes. And about 24% of the female population is overweight. Of course, 18% are underweight. So we have the other problem as well. And the other aspect which we must look at is that 56% of women have a very negative hip to waist ratio. So this makes them at higher risk for various disease. So I think raising the awareness is very, very high. And coming to that, I'm very happy to say that the trend and the conversations are now really shifting towards what can we do towards preventive health, how do we eat healthy, how do we screen better. PCOD, which was a big problem because 1 in 10 women have PCOD and they suffer silently, but people are now coming forward and asking. On the screening, that's another big proactive trend, but women with breast cancer, it's a very important thing for us to find these women earlier. The data on that one, if you're looking, is that every 3 minutes, one woman is diagnosed with breast cancer. And
Oh.
1 in 7 women will have breast cancer. One of the good news, however, is that cervical cancer, which was the largest cause of death for women by cancer, is now the incidence is coming down. The death because of cervical cancer has come down significantly because of screenings and early detection. So there's some positive trends also in this. And, traditionally, we would not think of women having lung cancer. But
Right.
while I told you that every 3 minutes a woman dies of breast cancer, every 7 minutes a woman dies of lung cancer. So this is also significant. Here you may this thing that, the percentage of women smoking or using some form of tobacco. So now you also have go into mouth cancer because of chewing tobacco, but 8 to 9% of women have some form of tobacco use. And passive smoking, when the male in the family is smoking, is also one of the contributors to lung cancer.
Dr. Reddy, the snapshot that you have given about the women's health, does this show that women, at least now, they have started becoming aware about their health? Because there is a thought that women keep on juggling between several roles and responsibilities, and they eventually neglect their own health. Do you see women coming to you and they are more aware now, and they know that they have to start health checkups? Do you see that change in women now?
Himani, you're absolutely right. Traditionally, women, they prioritized their family and their responsibilities over their own personal health. But they would delay a doctor's visit or self-care. But awareness is significantly increased now in the younger generations. Definitely, women are they're more aware of fitness, of muscle strength, of the importance of preventive care, of screening programs. And I think corporates also have started a lot of corporate programs. And Apollo has been partnering throughout in many, many of these. So we go into corporates and do health awareness. We're talking to women in societies. We run camps, rural women. We're doing lots of programs for rural women. In fact, one of our signature programs called Total Health, we have almost 26 yoga teachers who go into various villages and teach yoga. And this is not just for the younger women. Older women are now curing their back pain or at least feeling fitter and more active because of it. So I think it's very important for us to ensure that these trends continue and we support women in their ability to do everything that they're doing, but also to keep their own personal health at the center of all the work that they do.
Dr. Reddy, what is the age that you would advise that women should start going for regular health checkups?
So, Himani, now, the world is really changing significantly, and we are finding that Indian women are getting disease at younger and younger ages. So, at Apollo Pro Health, we've not only studied global recommendations, but also using AI and other data analytics, including a report that we've been doing for many years now called The Health of the Nation. We have brought out the recommendatory standards. So the annual mammogram and the breast examination must start from 40. But if you have a history of your mother, your aunts, your maternal aunts having breast cancer, then our recommendation is actually to start at 36 or 37, especially if you finished having children. So, because radiation is an important factor. The pap smear, and then, sorry, after that, the breast self examination must be done every month. Pap smear and HPV test, our recommendation is that you do this every 3 to 5 years. The
Okay.
blood sugar and the cholesterol tests must again start as young as 30 and
Mm.
become an annual program. Thyroid is another factor. And from a health and wellness perspective, vitamin D is important. The bone densitometry scan is another very important one, which you should begin immediately post-menopausal unless you are finding other symptoms of malaise, and then the doctor may recommend it in even younger women. Also, I think that one benchmark or baseline of a complete comprehensive health check, and then building your own personal path to health and wellness. So whether it's the percentage of fat, whether it is all the hormones and the parameters, symptoms like PCOD, each one of these, iron, because many women, from higher socioeconomic strata are also anemic. So these are, why should they suffer? We can easily correct these problems. We can educate them in that.
Right.
So this is another very important factor that we'd like to focus on.
To all women there, I hope that you have made a list out of all the categories that Dr. Reddy has just mentioned. All those are important parameters which we need to monitor. So, Dr. Reddy,
And
moving.
and sorry, Himani, just if I could add, these are the simple baseline ones.
Right.
I really encourage you to speak to your own personal family physician.
Hmm.
Sometimes homocysteine is very important. Sometimes there are other hormones. So many women, have allergies and they just suffer in silence. Some women with asthma, lung exercises, pranayama, breathing can give you a better quality of life. So my primary message is, work along with your family doctor, have a comprehensive health program, and become proactive about your own healthcare.
Right. Doctor, like you also mentioned, mental health. We see that a lot of women are now getting stress and anxiety and panic attacks. While we talk about the physical wellness, physical health, what do you think about the mental health? How do we take care of that?
So this is clearly, a range of things for mental health. Number one is just building confidence, building their ability to speak up, to be heard, to manage your own stress, to create environments that are conducive to you and not to suffer in silence. I think that as is a baseline principle. The second thing is if there are significant symptoms of anxiety or various disorders which are resultant of mental stress, I think it's important to face it and have the opportunity as well as not feel shy about saying, I want a counselor. I'd like to talk to a psychiatrist, a psychologist. See, in the earlier and sometimes the older generation doesn't realize because families, large families, were the psychological support for each other.
Right.
In an era of nuclear families, in an era where the stress levels are so much higher, where the pace of life is so much higher, and like Alvin Toffler said, the family was the shock absorber that people came home to after toiling with the world.
Hmm.
Today families are no longer that kind of a de-stress mechanism, or many families do are not, and if both are working, both come home stressed, then you have to take care of the children. So I would just say that if a woman needs to talk to somebody to get the reassurance to help them through their stress points, there is nothing wrong in it, and I would encourage them to do so, because end of the day, you're being completely mentally fit, healthy, and happy psychologically is something that you deserve. And by being in that state of mind, you will be able to fulfill all your responsibilities and live up to all your dreams in a much more positive manner.
Yeah,
So,
so
on
ladies'
that note,
message
I'm
is
uh,
very clear that you need to take care of your mental health too, and don't shy if you feel that you need to talk to somebody, even if that's a mental health counselor. Go and talk to someone. Dr.
absolutely correct.
Dr. Reddy, you also juggle between both responsibilities, professional and personal, and I'm sure that you must be dealing with a very hectic schedule of your own. Give us some advice, how you juggle between the several roles and responsibilities and take care of your personal and professional lives both.
So I think that nobody's perfect, and I have a long way to go in my own personal health and physical fitness routine. But I have over the last 3 4 years really prioritized that.
Mhm.
I think one of the big things that I learned early on in my career is to build a support system. So whether it is your mother, your mother-in-law, your nanny, your house staff, whoever it is, build a support system, because if you want to do many things, you cannot be in every place all the time, and don't suffer from guilt. I think every mother has that guilt of not doing enough for their children. Don't, because I believe every mother is amazing. So create your support system. Don't suffer from guilt. Prioritize what is important, and understand that at different phases of your life, different things will be a priority. So you have a newborn baby, don't feel stressed on the 60th day that you're not able to give everything at work, or the 90th day, whatever milestone you've chosen, and enjoy that time with your new baby. And figure out how you can stay in touch, keep yourself mentally abreast, while still giving your complete time. Uh, uh, it is many, many personal journeys, and everyone find different solutions. But let your solutions stem from the confidence and the courage that you can and you are amazing, that your family deserves to support you, your husband and everybody else, they deserve to support you. You don't have to do it all on your own. And finally, most importantly, do what makes you happy. You
Dr.
are
Reddy,
at
do you
first
have,
accountable to yourself.
right, right. Just pick one thing from your routine that you think that, ladies can include that in their routine and may feel a difference.
So I do a 15-minute pranayama. I wish I was doing more, but I think that the breathing and the mental health, the meditation, give me a lot of strength, a lot of composure to enable the multitasking and all the various things that we do in our lives.
Right. Doctor, before I let you go, I would just ask for an advice for all those women who keep on complaining that they don't get time to exercise regularly. So do you think that there is any way they can incorporate some other, healthy habit into their routine that can help them?
So I feel very guilty answering this question because I am probably one of those who didn't prioritize physical fitness enough. But I think point number one is you don't have to, wear your exercise clothes, go to the gym every day if you don't, if you don't have the time to do so.
Mhm.
Just climbing 2x staircase, extra, moving around a lot more. So being physically active, being flexible, and being capable of living up to your routine without going out of breath. These are the simple, fitness and wellness rules, which is perfect up to a certain age. Once you cross, your 45s and 50s, it is important to start spending the time for a structured fitness wellness program, because sarcopenia starts. And when you start losing muscle mass, then everything else is at risk. So, building your muscle mass, keeping that healthy, and taking care of yourself. So, beyond a certain age, I would say it's mandatory. And in the when you're younger, you can enjoy fitness, play games,
Mhm.
weave it into your social activity. I
Right.
think that's something which is a lifestyle change that I would recommend to the younger generation. That meeting together for recreation and friends is not always, meeting for dinner or at a pub. Sometimes, creating friendly gatherings around a pickleball court or a tennis court is really, or even a swimming
Wow.
or even hiking over the weekends. Some of these are things that I would recommend. So it's not like the gym as an exercise, as something I have to do, but it's fitness as fun and part of my lifestyle.
That's a fantastic idea. So, well, to all women watching, take care of your health as you take care of others. Your health matters. Once again, Dr. Reddy, thank you so much for joining us. We appreciate your time and expertise. Thank you so much.
Thank you, Himani, and it's a great pleasure for me on behalf of Apollo and all the women working here to wish all of you a very, very happy Women's Day. Stay healthy, stay happy.